Turning to provincial politics, the Ford government says it will do away with 6-note requirements for employees for short absences. The province says it's part of a larger effort to ease the administrative burden on doctors. Legislation will soon be introduced that will no longer allow employers to require a sick note from a doctor for the 3 days of sick leave workers are entitled to under provincial law. An employee will instead be able to give employers an attestation or a receipt for over-the-counter medication. Health Minister Sylvia Jones says they are also expanding a pilot program that allows doctors to use artificial intelligence to take notes of conversations with parents.
As part of our government's Patients Before Paperwork initiative, we have already taken action to axe the facts, to speed up diagnosis, referrals, and treatments. We've expanded e-services to digitize more referral and consultation forms so that they can be conveniently shared electronically, and to improve the e-form platform to make it more convenient for providers to autofill and share forms, freeing up as much as 95,000 hours per year.
Jones says she will have more announcements to make to streamline healthcare as soon as the province is done negotiating with the Ontario Medical Association. Meantime, the Ontario College of Family Physicians is praising the axing of the doctor's notes.
One of the things that family doctors are struggling with right now in Ontario, and I would argue across Canada, is the administrative burden. In Ontario, there's been a study to show that we spend about 19 hours on administrative work every week, and that's when we're not in front of the patient. So it's almost 2 days of work on top of seeing patients, which is really what we're trained to do and what we really like to do, is to take care of patients. So I think eliminating this sick note does a few things for us.
Speaking on behalf of the college, Dr. Alan Grill says eliminating the notes frees up family doctor resources, removes a cost for patients that isn't covered by OHIP, and allows those patients without family doctors to no longer have to worry about getting a note from a walk-in or an emergency room. Grill says more needs to be done to free up family doctors to focus on treating patients, including a centralized referral system and computer-automated note-taking.